This case is of a cancer in the right pharynx. The patient was treated with 5,000 rad of radiation at another hospital, but the disease has recurred. Radiation doses of 400 rad per fraction were given twice a week for a total of 9 times. After each application, hyperthermia was delivered at 42 to 43 degrees centigrade for 40 minutes, also for a total of 9 times. As you can see, the tumor which recurred on the right side has completely vanished. This is a case of a 61-year-old male in which stomach cancer recurred following surgical treatment. As seen in the CT, a large metastatic lesion is visible surrounding the bladder and extending to the abdominal cavity and wall. The patient was given intravenous anti-cancer therapy in combination with hyperthermia to observe the effects. This is a picture taken just after the end of the combined therapy. The lesion surrounding the bladder and the lesion spreading over the abdominal cavity and wall have virtually disappeared, and the size of the bladder has returned to normal. This is a case of liver cancer in a 65-year-old female. There is a large tumor of about 10 by 12 centimeters in the right lobe. She was treated with 16 courses of hyperthermia at 41 to 42 degrees centigrade, together with the administration of OK-432, an immunomodulating agent. This was taken after completing the 16th heat treatment. The tumor size is greatly reduced. 2 years have passed since the treatment, and the patient is doing well and enjoying her health. This is a case of a 65-year-old female suffering from a primary liver cell cancer. CT before treatment revealed a tumor of about 10 centimeters in diameter, invading the portal vein in the right lobe. She was treated with 16 courses of hyperthermia, combined with the administration of picibanil and futrafol. After 1 month, the tumor was found to have completely disappeared upon CT. At this point, the AFP, which was as high as 425,000 before treatment, returned to normal. A CT scan 3.5 years after therapy shows scarring of the original lesion without any evidence of recurrence. However, a new lesion of liver cell cancer was found in the left lobe and was removed surgically. At this point, she has survived 5 years since her first treatment. This is a 72-year-old male with a case of bone metastasis of bladder cancer. A large mass occupies the right half of the pelvic cavity. This patient was given a total of 6,000 rad of radiation and 6 courses of hyperthermia. This is the temperature distribution during heating. The tumor is heated to 42 degrees centigrade in the peripheral area and 46 degrees centigrade in the tumor core. This is the CEA after treatment. It rapidly declines from the level during treatment and becomes normal 3 months following treatment. This shows the change in tumor volume after treatment. After 2 weeks, it shows some shrinkage. But after 4 months, it shows a significant reduction in size, after which it gradually decreases in size during the course of 1 year. Moreover, bone regeneration is seen in the bone-damaged area. Two and a half years after treatment, this patient is still living without recurrence.
Dr. Matsuda, Vice President of Tokyo Metropolitan Komagome Hospital, is the chairman of the Hyperthermia Research Group supported by a cancer research grant from the Ministry of Health and Welfare, and has done splendid clinical research work. He summarizes the therapeutic results of clinical hyperthermia to date. The results shown here represent work done by the Matsuda Hyperthermia Research Group, supported by the Ministry of Health and Welfare. The heating apparatus used was the Thermatron RF-8 at 6 participating institutes and the BSD 1000 at 2 institutes. The results were evaluated according to 4 categories: CR, meaning complete disappearance of the tumor; PRA, tumor shrinkage of 80% or more; PRB, tumor shrinkage of between 50 and 80%; and NR, tumor shrinkage of less than 50%. The effective rate is represented by the total of CR and PRA. These are the results for superficial tumors that are deep-seated to about 7 centimeters from the body surface. The number of cases is 292, including 51 cases, 17.5%, of primary lesions. The other cases are metastatic lesions. This is the temperature of the tumors. The temperature was measured in the tumor core and peripheral zones, and the average value is shown here. A temperature higher than 42 degrees centigrade is seen in 169 cases, or 72%, indicating satisfactory heating. This shows the pathological findings and the primary effects. As seen in this graph, the effects of hyperthermia are almost independent of the pathological findings. This shows the relationship between the therapeutic effects and tumor size as represented by the maximal diameter. In tumors 10 centimeters or larger, therapy was effective in 22 out of 45 cases, or 49%. These are the effects of combined hyperthermia and radiation therapy on deep-seated cancers and visceral organs according to pathological classification. The total effective rate of CR plus PR reaches greater than 50% in cases of rectal, cervical, colon, bladder, and lung cancer. A combination of hyperthermia and chemotherapy has also been used recently. This is Dr. Matsuda's report on the clinical results of hyperthermia combined with chemotherapy at 4 institutes in 1986. The total of CR plus PR is 32%. The pain reduction effects of hyperthermia were reported by all of the participating hyperthermia researchers, a finding worthy of note. This suggests that hyperthermia will play an important role in the care of terminally advanced cancer patients. To be further investigated. Evaluation of the effects is one of them. This is a case of rectal cancer. The size of the tumor is the same before and after treatment, but the inside of the tumor has undergone necrosis. Firm guidelines for evaluating such cases must still be decided. For measuring temperature, a non-invasive method is now being investigated. Many approaches, such as ultrasonic waves, nuclear magnetic resonance, and heat radiation, have been tried. Development of a non-invasive method will serve to enlarge the clinical use of hyperthermia, as well as aid in the diagnosis of cancer and circulatory diseases. Hyperthermia equipment must be selected according to its ability to adequately heat different types of lesions. Various factors must also be considered, such as performance, data acquisition capabilities, patient pain caused by treatment itself, and other factors. Hyperthermia has a great deal of potential, and it must be further developed through cooperation and close communication in a wide range of fields, including a variety of specialties in medicine, biology, physics, and engineering. Thus, hyperthermia is a highly promising multidisciplinary scientific therapy modality.